Most couples are likely to get pregnant within a year of trying to conceive. The greatest achievement may occur in earlier months. Some couples will conceive in the next year of trying. Therefore, infertility has come to be characterized as a failure when couples are unable to achieve pregnancy within a year. It's best to have professional diagnosis when there is a failure of conceiving in 12 months of period. There are a number of factors which can be monitored and prevented in advance. Those are infrequent menstrual periods. When a woman has normal menstrual periods, which are described as a regular cycle, occurring every 21 to 35 days, this almost always means that she regularly ovules. Egg ovulation occurs about 2 weeks prior to the start of the next cycle. If a woman has periods of more than 35 days, it may mean that she predictably does not ovulate an egg or even at all. Egg ovulation is key to pregnancy. Female age of 35 years or older. When women age, egg number decline quickly. Unclear reasons. In fact, as aging happens, the consistency of the eggs or the probability that an egg is genetically normal declines. It suggests a fertility examination if the woman is 35 years of age or older and when a couple has been attempting pregnancy for 6 months or more. A pelvic infections records or sexually transmitted disease. Sexually transmitted disease such as chlamydia or gonorrhea may cause fallopian tubes to become inflamed and permanently scarred. The existence of open tubes is important for natural conception. A sperm must cross the tubes to an ovulated egg and fertilize it. For a couple attempting pregnancy, it's recommended an immediate evaluation when the woman has a prior history of pelvic infection. Hysterosalpingogram, as a part of fertility evaluation, is a test designed to measure whether the fallopian tubes are intact. Non-uterine fibroids or endometrial polyps. Uterine abnormalities such as fibroids indenting the endometrial cavity and endometrial polyps can affect how the endometrium, the uterine lining, and embryo interact to lower rates of implantation and pregnancy. These anomalies can also cause menstrual cycles to bleed irregularly. 6 months of attempted pregnancy in women with a known history of those abnormalities or a history of bleeding between menstrual cycles should be followed for evaluation. Hysteroscopy, a surgical procedure, is a primary approach to correcting or eliminating these uterine anomalies and male semen abnormalities. Infertility test, history and physical examination. Your fertility practitioner should take a very detailed overview of medicine and fertility in the first place. Those initial checkups will be based on questions about your sexual health. Transvaginal ultrasound. Ultrasound is an important tool for assessing uterine structure, tubes, and ovaries. Ultrasound can detect uterine abnormalities, including ovarian cysts, such as fibroids and polyps, distal fallopian tube occlusion, and ovarian abnormalities. In fact, transvaginal ultrasound provides a doctor with the ability to determine the relative number of eggs available. Laboratory testing. Based on the assessment results mentioned above, the doctor can order specific blood tests. Measurements of blood levels of certain hormones such as estradiol and follicle-stimulating hormone related to ovarian function and overall egg numbers are the most common of these tests. Thyroid-stimulating hormone, which evaluates thyroid function, and prolactin, a hormone that can affect menstrual function if elevated. Hysterosalpingogram. This test is important for determining fallopian tubal notability, uterine filling defects such as fibroids and polyps, and uterine cavity scarring. Most detected uterine and tubal defects can be surgically rectified. Semen analysis. The semen examination is the key test for evaluating the male partner. 4 parameters are analyzed. First, amount of semen should be at least 1.5 to 2 milligrams. A smaller quantity can indicate a structural or hormonal problem, which leads to poor semen production. Second, sperm concentration. A normal concentration of at least 20 million sperm per 1 milligram of semen should be required. Higher concentration will lead to lower chances of untreated conception. Third, sperm motility or movement. At least 50% natural motility. Less than 50% motility can have a significant effect on sperm's ability to fertilize the egg without treatment. And fourth, morphology. Of forms, 3 parts of the sperm are examined for morphology: head, midpiece, and tail. Anomalies in any of these regions may imply irregular sperm function and may affect sperm's ability to fertilize the egg. Ideally, a minimum of 5 to 15% normal shapes using strict morphology guidelines leads to a better ability for sperm to fertilize the egg. The irregular examination of semen typically requires a further assessment by a reproductive urologist. Overall common causes of infertility are age factor, ovulation disorder, tubal occlusion, uterine fibroids. Fortunately, there are a number of IVF treatments to cure infertility. Stay informed about your health and conceive successfully.